Good afternoon. I am Dr. Daniel Hill with Downtown's Healthcare, and our topic today is chiropractic adjustments or treatments for scoliosis. And if you look at this x-ray right here, we call that an A to P lumbopelvic x-ray. And it's probably very obvious to you that there's some sideways curvature of the spine. Scoliosis is exactly that. It's actually sideways curvature of the spine and the lumbar spine. And then you can see the little points right there. Those little points are actually showing us where the spinous process is, and spinous process is, and the spinous process is the point that you feel if you rub your back, that little bump, and you've got one on each vertebrae. So in addition to this thing being curved, it's also rotated. So this is a pretty complex type of scoliosis, and the best way to diagnose scoliosis, certainly you can look at somebody's posture. The old school way would be to have them bend forward, and you can just you can visually see what's going on with their spine. But the best way is x-ray, and then after we treat somebody, we do take follow-up x-rays, oftentimes anywhere from 90 to 120 days later, to measure the amount of change. So this is a fairly significant scoliosis, and so if you go ahead and look at my spine model here, I'll try to make the spine replicate what you see on the view box here. So it's got the curvature, the sideways curvature to the right, and then it's got this rotation, if you will, like this. Just so you know, it only takes a dime's weight of irritation on these nerves. A dime's weight is not much at all to dial down or slow down the nerve flow out of here by as much as 60%. Now, the biggest concern with scoliosis, and why a lot of people sometimes will have to eventually end up getting surgery or some sort of bracing, maybe it's what they call a Milwaukee brace. It's worn on the outside of the clothing, or unfortunately if it's really severe, they have to have surgery and they have to put steel rods in here. These are called Harrington rods, and it's not good for the patient. Oftentimes they end up with severe. It does straighten the spine. It does take pressure off these nerves. Unfortunately, they end up with arthritis and many times debilitating back pain. The problem with scoliosis in this part of the spine, where the organs are, is that the scoliosis could be so severe that it could put pressure on the nerves that go to vital organs like the heart or some of the digestive organs. Okay? So I'm going to show you on the table how we might adjust somebody. So this person is lying like this, and what I would do is I would actually try to bring their legs this way to level things out. And then I would use the drop table on the hip and on the lower part of this hip to actually align that. And then we would be doing an adjustment from the side. Okay? So I'm going to actually show you what that looks like on Valerie right here. Okay, Valerie, let's have you lie on your stomach. So you remember from the x-ray and also from the spine model that her spine curves to her left, and that her leg was shorter on this side. So we're just going to literally bring her legs to the left to level out her pelvis, cross the leg over because her tailbone was actually low on this side, so that brings the tailbone back. And then she had that curvature in her spine. So one of the things we can do to help with the curvature is we can put a wedge right here, and that'll help take the curvature out. And then the adjustment, we use the adjusting table, the drop table, to make part of that alignment, like that. And then I will have her turn on her right side, facing that lime green wall. So once again, her pelvis was low on her left side, and her spine curved that way. So we want to actually align her spine down towards the table or the floor. We're going to actually have her lift. We're going to put a wedge here. What this does is it pre-stresses the lower back so that when we give her a chiropractic adjustment. We don't have to use as much pressure. And I can do that either with the table dropping down, which is a little more gentle, and then as we continue treating her and as her body gets accustomed to the pressures and the adjustive forces, then we can actually do that with a hand adjustment. You know, I'd roll her over this way to take some of that rotation out of there, and you can feel that that moved very nicely. And then we'll also put her on the other side. And typically with the scoliosis, her spine went to her left, and if we followed it up far enough, in her middle back, it would actually try to correct itself by going to her right side. So we're going to actually put this under your armpit, like this, and that'll actually help correct that upper part of the scoliosis. And then we're going to be treating the lower part of her hip here. Great. And then in addition to the chiropractic adjustments, we give people lots of stretches. We give them exercises, and then there's what's called spinal molding exercises or blocks. So you remember when she was on the other side, go ahead and turn on that right side for me, Valerie. She had this block underneath there, and the idea there is to move her pelvis underneath the curvature, which in essence is taking that curvature out. And I would have her at night lay on this block anywhere from 10 to 20 minutes every night. So that's how we take care of scoliotic patients. If they respond well, then chiropractic can help them very nicely. If we find that they're not responding, then there are different avenues that we can refer patients to that have a little more aggressive approach. So I'm Dr. Hill with Downtowns Healthcare, downtownshealthcare.com, and our phone number is 303-292-9992. Thank you so much.